we on?
We're on.
Okay, awesome. All right.
Hey guys, we're here at East Texas Physical Therapy. We are going to kind of just do a question and answer session today about direct access and kind of talk a little bit about what that is, what that means for us as a state, as the physical therapy profession, and then kind of go through and answer some questions. Thomas, we see you, and we can actually see you guys when you log on to watch us, and we're probably going to go through a couple of common questions that we thought a lot of people would ask anyways, like what is direct access? And so hopefully we'll answer some questions as we kind of go through that list, but we would absolutely love for you guys to just hop on here, ask us whatever it is that you're kind of wondering about direct access, or really any questions for our clinic. And we are going to do a drawing for a 30-minute massage if you post a question and kind of interact with us a little bit on this, and just kind of get some information out and get everybody educated on what direct access is.
So while we're waiting on people to join, why don't you guys introduce yourselves?
Right, Jason, good after.
Very good. Okay. Hi, everybody. I'm Jason Manus. I am a doctor of physical therapy. I'm also a lymphedema certified therapist. And I have been practicing for close to 20 years, something like that. And we started East Texas Physical Therapy in 2011. So we've been around a while, and direct access is something that we've always wanted. We're excited about it. And so hopefully everybody will get to learn a little bit today.
And I am Leslie Northcutt. I'm also a doctor of physical therapy here at East Texas Physical Therapy. I'm a clinical director. And just in case you guys don't randomly know anything about our clinic, we are both physical therapists, but we also have occupational therapy, speech therapy, and as of last year, we added chiropractic services, which has been amazing. And we also have a massage therapist here. So we've kind of really grown over the past years. It's kind of crazy to think we've been open for that long.
I know. It's a lot of growth.
It's
been crazy. Good.
It's been awesome.
Yes.
Okay, so let's get into it. Tell me what direct access is. What does the law actually mean to us?
So recently, and you guys are all logging on. We can see your names over there. Recently, as of September 1st, actually of this year, let's back up a little bit. The House presented a bill that would basically give patients the access to come into a physical therapy office and see a doctor of physical therapy for an evaluation without a physician's referral. So for some people that sounds new and kind of crazy, but we are actually the 49th state to approve this. So we are not the first on this front. Like Jason said, we've been hoping and praying for a long time that this was going to go through, just because we feel like it is vital and it is part of your right as a patient to have access to that care. But basically the law went into effect on September 1st this month. And it allows you, when you have an injury, to call us and come in and get a referral. You don't even need a referral, basically. Before, in the past, you had to go to your physician, you had to get a prescription saying, I need physical therapy, and then you brought that referral or prescription up here and we got you scheduled. Now you can actually just call our office and we get you on the schedule and get you in as soon as possible and kind of evaluate you and get rolling with therapy, basically.
Is this safe for the patients?
Yes, it is safe, as a matter of fact. And just to kind of give you an example, our training, we go to school for several years, some of us 7 years, and we take differential diagnosis. We radiology, pharmacology, all of that. But we're trained to look for red flags, yellow flags, things that would make us stop and say we need to use some caution and maybe refer back to the doctor. So it's absolutely safe. And if you looked at the research, and this was part of pushing through for this to get direct access, PT in general is very safe. And there's not a lot of missteps when it comes to other states that have direct access. And Leslie was talking about direct access. Just to give you an example, if you sprained your ankle and you needed to have it looked at, in the past, before you came to see us, you might even went to the ER. The ER then would have referred you to the ortho or your primary care doctor, and say it's just a first or second degree sprain, whatever. Now you can come to us, get the treatment going, and get on track and be back out there doing what you want to do pretty quickly. So anyway, yes, to answer Sissy's question, it is safe, absolutely.
And there's actually an article, I think we may have posted a link to it recently. If not, we will get that up there.
Correct.
That kind of shows, they did a research study to kind of see who has the equivalent knowledge as far as a lot of these orthopedic things go. And physical therapists actually rated right next to orthopedic doctors. So those were the only two people that had that education level on the musculoskeletal system. So we definitely feel confident in the training that we've had to be able to provide that level of care and really get you guys in and be proactive about that.
How is this going to affect care as far as the doctors go?
I think that's a great question. So a lot of people say, oh no, does that mean that the physician's just been taken out of the equation? No, absolutely not. So what that means is that you are able to come in and see us for 2 weeks or 10 business days, which is the equivalent of 2 weeks, of course. And we can get your therapy rolling. But then at that point, we are going to look at you and basically send that full thorough evaluation that we do to your physician, your primary care, your orthopedic, if you already have an orthopedic, kind of wherever you want us to send that to that physician, and then you are going to follow up with them. So they are going to be in the loop. You know, I always say your care, it's not just us. We are a team. We work very, very closely with these physicians. So we are going to call over there and say, look, this is what's going on. They need to get in to see you. And of course, if we feel like you need an MRI, a CT scan, an X-ray, at that point when we send you into that position, they're going to order those images right then. So I would definitely say no, the doctors are definitely not taken out of this equation. They are part of your care team and will continue to be part of your care team. Like Jason used that ankle sprain example. This is just if you have an injury, we can get you in quick and get you seen. I think a big problem in rural East Texas, where we're located, is that these physicians are super busy. So if you have a problem and you're not able to get in for 3 or 4 weeks, your shoulder could be frozen by the time you get it in and get to see that doc and get back to us. So I think this is just really great to put care in your hands and allow you to be proactive as a patient and get that care quicker.
All right. What about money? Will my insurance pay for these visits, for this evaluation?
I kind of saw the paper there. I wish maybe we had our billing people in here.
I actually talked to Candy this
Did
morning.
you?
I did.
What's the verdict on that?
So as far as the insurance goes, it's actually kind of crazy because once again, we are not the first state to have this. We are actually almost the last state to have this. So this is not these big companies' first rodeo with this. Blue Cross Blue Shield, United, and not all of the above. So as far as that goes, those companies are actually already used to dealing with this. And in a lot of the paperwork, they actually do not require a physician's referral for that initial visit. So needless to say, most of your PPO plans, absolutely, they are going to cover this. And keep in mind too, we also have an excellent billing team that we talk to all the time, all day, and call over. If you guys are familiar with us, that's Candy and Macy that used to be in the front office, billing and compliance. So they're going to run your benefits. We are going to call and verify all of this and can do that before we even see you if that is something that you are concerned with. But most of these insurance companies have already been dealing with this for years, so this is not something new. We are not the first people to blaze this trail. I will say if you have an HMO, and you're probably used to this if you know anything about your HMO policy, most of them do require a pre-authorization. So anything that requires a pre-authorization, that basically means you have to have permission to go and do that. So yes, so at HMO, if you are workers' comp and you re-injure yourself, you are going to have an authorization through your workers' comp claim and company. So if you injured yourself at work, you would go and follow up with your workers' comp physician that your company would send you to, and then they would give you that authorization and you would come to us. So it's basically anything that needs what we call an authorization or pre-authorization. You still have to follow those channels like you did before, and that's just because they're regulated a little bit differently.
Okay, guys, we have a question
All
from
right,
a viewer.
all right.
Peggy Price wants to know, can I come see you if I wake up dizzy?
Peggy, we love Peggy. Absolutely. So I feel like that's something that we get a lot of quick referrals from, that people go to the doctor for a lot around here. I mean, just something that's a common issue, and we see in all age groups, really, to be honest. Yes, if you wake up dizzy, if you've had any history of what we call BPPV, or a lot of people talk about those little crystals in your inner ear getting out of place, that is something that your physician is going to send you to us for anyways. And if you have a severe case, you are very nauseated, disoriented, sometimes it's even difficult to walk. So they are going to send you to us to get that maneuver done anyway. So absolutely, you call, we will get you in, get you reset, and make you feel normal again.
I want to add to that. That is a good question. I think it's one of the physical therapy Facebook accounts for the state. I think the first patient treated was actually a patient that was at church that had dizziness. And so the therapist took her on right then, did the maneuvers, fixed them in one visit. So absolutely, those are things that you can come see us for. And again, I mentioned, we're very well, we go through differential diagnosis and all that in our training. And so if you came over here and you're in, like Leslie or Annette, or excuse me, myself, we saw you and we felt like the dizziness wasn't associated with something that we were comfortable with, we refer you right away to the proper channels.
Absolutely.
Yeah. Good question.
Okay, so what types of patients will benefit the most from this change? I know we've talked about it a little bit.
Definitely. Different types of patients that are going to benefit from this. The ankle sprain was really great. So I know a lot right now, it's football season. So that's a perfect example. If any of our surrounding athletes or anybody has an acute injury to where they feel like maybe an ankle sprain, or they hurt their arm throwing the football, I'm going to use that as an example. Any type of injury like that. Now, I will say, if you injure yourself and it is an emergency situation, I know this sounds like common sense, but of course you're going to call 911 or go to the emergency room. If you think you possibly have something broken, they are going to need images immediately. So those emergency situations, of course, you are going to continue to go to the emergency room. The physician and the imaging team will definitely be evaluating you there for that. But if you are, you think you re-injured your knee, if you think you rolled your ankle, those are the things that you want to come, or maybe you've got an old shoulder injury and you flared up your rotator cuff at work. That's a great thing that you want to call in and get us to evaluate you for. We're going to do those special tests and kind of do our own physical therapy diagnostics and kind of see what's going on. Or a chronic injury. Maybe you've had knee problems for the past 5 years and it's been doing really great, and you stepped off of something and over the weekend and it just started really bothering you, or your hip got flared up doing yard work. That's a perfect example of something that you're going to want to come in and see us for. And like we talked about before, if we feel like you need any imaging, if we feel like anything with our differential diagnosis sends up red flags, of course, we're going to send you to the physician for imaging anyway. And the doctor that's probably already taken part in your care, that's who you're going to go back to get that. We're going to send our plan of care to and our evaluation to.
Okay, what type of patients would not benefit?
Well, so you're out there and you have an injury and your bone sticking through your skin.
Yes.
Not benefit.
No.
Okay,
please.
So I think there's a lot that covers that would benefit. I think Leslie hit it. You have probably use your own judgment. If you feel like this is something that you need to go to the emergency room for or see your doctor right away, absolutely do it. I don't even mind if you called up here and you gave us a little bit of a description over the phone.
Right.
If we felt like we need to send you, we're going to send you. But use your own judgment on that. If you're a weekend warrior out there playing softball, you turn your ankle, sprain your knee, hurt your back, something like that, give us a call. We'll fix you up. But things protruding through the skin, or can't move, so maybe go see your doctor. Go to the ER right away.
Go to the ER for sure. And something else. I know sometimes I had a patient recently, a patient's family member approached me in the community. If you are post-surgical, so if you just had a shoulder replacement, let's say, or maybe you had a complicated spinal surgery, that's a case where a lot of times we have what's called protocol. So the that initial part of post-surgical is really focused on healing. And some of these, they're going to want you in here. I had a total knee yesterday that was 2 days out. So sometimes they are going to want you in PT immediately. There are some surgeries that are a little bit more complicated that you really have to heal before they kind of attack that next mobility portion where they send you to us. So if you're thinking, oh, why is my doctor not sending me to PT yet? That's not an example of when you should come in, because now if your doctor is not going to prescribe you physical therapy at all, I would definitely bring that up and have that conversation with him or her and say, hey, I really think some physical therapy would benefit me, and you guys have that open conversation. But there may be a reason, and when you have that conversation, they may say, hey, that's a great idea, but we're going to do that 4 weeks out from when you had your surgery. So that's a conversation you want to have with your surgeon, and then they will send you to us. And while we're talking about that, you have the right to choose where you go to physical therapy. So if they know that they're going to send you to physical therapy, and you know that you love us and you want to come see us at East Texas Physical Therapy, at that point, yes, right here, shout out, check our website out, give us a call on our phone number here and call the front office, and we can even send over. If they give us a call from the office, or you give us a call, we can send over a prescription pad that has everything already filled out, makes their life easier, makes your life easier, and then get you on the schedule as soon as possible. So please also remember that you have the right to choose where you go, no matter what.
Okay, we have another viewer question.
All right.
Patty Fromberger wants to know, can we come in with lower back pain?
Absolutely. That's probably one. We see a lot of pelvis issues, misalignment. They'll tell you got a hip out of place or a hip off. So that's something absolutely, especially if you have issues with it and you've had issues with it before, we will definitely evaluate you. And if you don't have somebody, we can help you kind of follow through and figure out who you need to go see. And maybe if this is a recurring problem for you, get you at the right physician as well to kind of start taking part of that care, and hopefully get you, like I said, one of the biggest benefits of this is you can get in here and start receiving treatment, and you don't have to wait 2 more weeks and let your back be flared up and angry for 2 more weeks or 2 more months for that sake, before we start to be proactive and really take part. So I think absolutely you can have low back pain.
Also, on the same note, we've got chiropractic now.
Yes,
so
we do.
We can see these on both fronts. So just remember that as well.
And our chiropractor takes walk-ins. So feel free. Of course, this number will get you to our front office. Mm-hmm. That can also get you scheduled with Robin. Dr. Robin takes walk-ins any day that she has availability in her schedule. So please feel free. If you've got some issues with that and you just want to have her look at you, kind of do an assessment on you, we can definitely get you in. You just give us a call, and our front office will let you know her first availability.
Okay, first of all, shout out Chastity Pierce for saying thank you for all the help we've given the patients that her office has sent us.
Aww.
Thank you, Chastity.
And then a question from Jamie Murphy. I've been dealing with Achilles tendonitis for over 4 months. I'm on PCP, been doing her recommended stretches with no results. Probably time I come see you.
Absolutely time you come. 4 months, that's a long time. At this point, it is definitely chronic. So absolutely, please give the front office a call. Let's get you in. Let's take a look at you. And don't forget, we've got, we do a lot of different things here. We are a very manually based clinic. So the stretches are great, but sometimes you need a little bit more of an aggressive approach. So we may do some instrument-assisted soft tissue mobilization or some dry needling, and that may really speed up your rehabilitation process. So definitely give our front office a call and call this number, and then Tanya or Diana can get you on one of our schedules as soon as possible.
Yeah.
Okay.
Can I just say one other thing?
Of course.
And Leslie, correct me if I'm wrong, I just want everybody to know that the law gets into, unfortunately, not all therapists are going to be able to do this, correct?
Right, and let's talk about that, yes.
So
yes.
Leslie and I mentioned at the first that we have our doctor of physical therapy. So we are able to do this. We've both been practicing more than a year. Some of the therapists from several years ago that might have had a bachelor's degree or a master's degree, I think there's going to be additional training for that. So I just want you to be aware if you're going to a physical therapy practice, they'll probably make it clear if they're able to treat you, but it's not every physical therapist. And hopefully down the road, we'll get that everything squared away.
Yeah.
But is there anything else you want to say about it? Is it a DPT, practicing longer than a year?
Yeah, so those are the two main things. And
Right.
then he's right, there's some continuing ed. It's pretty some pretty heavy continuing ed that somebody with a master's degree
Right.
can come back and take that continuing education and basically go back through those differential diagnoses diagnoses classes. So definitely any clinic that you go to, of course, should only set you up with somebody who's able to do this. Correct. So that it will actually be covered. But that's something to kind of be aware of going into it. If you've seen somebody that you like before, they may not be able to treat you that initial evaluation session because that may not be applicable to them.
Correct.
Okay, guys, we have a great question from Lisa Williamson.
Yes.
How long is a typical wait for an appointment?
That's a good question.
That's a great question. I would say we actually are pretty flexible right now. And because this has been implemented this month, we are trying to block off a couple of blocks throughout our weeks and kind of be prepared, I guess, for any of these direct access walk-in referrals. So I would say, if we have a spot, we will literally get you in that day if possible. But for sure, within that week, we will make it happen within a couple of days. And we will just literally look and see which one of our schedule we can get you in the quickest.
Yep.
All right. Shout out Estebana. We love you,
we miss you. And hey, thank you guys for tuning in. We really
Absolutely.
appreciate it. We love getting on here and doing these live videos.
Absolutely. Yeah. Thank you.
And asking questions off the cuff. But if you think of anything else that pops up in your head, whether you need to come see us, like Jason said, we are more than willing to, you guys call up here and we'll kind of have a conversation with you and decide if that is what we think you need to do. Or if you have any other questions, please feel free to just post them right there on Facebook and we will go back and answer any questions possible. And everybody who did ask a question, thank you so much. And we are going to enter you all in a drawing for a 30-minute massage. So we will be putting that together and then we will draw pretty quick within the next 15 minutes. We'll do the drawing and get that result on there and let you know who won.
All right.
Thank you.
Bye. Have a great weekend.